You know, I'm a fifth-generation Iowan, a lifelong Democrat, and I'm running to be the next governor of the state of Iowa. And we're here to... Thank you. But we're here today to discuss mental health and substance abuse. And I'm grateful to the Des Moines Register, Des Moines University, and the Iowa Hospital Association for holding a forum on such an important issue. In fact, the second forum on this issue. My wife Charlotte and I have worked for years to improve access to mental health care in Iowa. A few years ago, Broadlawns approached us and some other people because they had a growing shortage of beds and psychiatrists with no place for the people with mental health to go. Charlotte and I helped them expand their facilities to provide a 50% increase in mental health beds and add 2 new psychiatrists to better serve patients with mental health needs. Make no mistake, we face a serious mental health crisis in our state. And whether it's you, your family member, your friend, or a neighbor, everybody is affected by the lack of critical mental health services across Iowa. Senator Rita Hart, who I'm proud to call my running mate, and I have spent the last 18 months traveling across our state, listening and learning from people about the issues affecting Iowans most, including mental health. Last October, I traveled the state on a mental health tour, mostly visiting county jails and listening to law enforcement officials who told me how they basically have become the de facto catch-alls for those who are suffering from mental health issues. Rather than sitting in a jail cell, they need to get the care that they deserve. Law enforcement resources are stretched thin, and officers are now spending hours driving across the state to get people the mental health treatment that they need. In our rural communities like Harlan, Iowa, I heard about a serious mental health problems facing our farmers. Farmers have the highest suicide rate of any profession in the country. Due to the mental health stigma, they are often hesitant to seek help, and even if they do, they often can't find any local mental health services. A couple of weeks ago, I got a call from 2 terrified parents in Cedar Rapids. Their 12-year-old son was sleeping on a couch in an emergency room, waiting room bed, while he waited for a mental health bed to become available because there weren't any. That's not acceptable. So let's go back. How did we get to where we are today? For the last several years, the Branstad-Reynolds administration has systematically undermined and underfunded programs and facilities designed to help those who are battling a range of mental health issues. For the last 20 years, Iowa has been given either a D or F by the National Alliance for the Mentally Ill. The managed care disaster implemented by Governor Branstad and continued by Governor Reynolds has resulted in fewer Iowans receiving the care that they need. According to the Treatment Advocacy Center, in 2016, Iowa ranked dead last in the number of psychiatric treatment beds available per capita and 47th in the number of psychiatrists licensed to provide care. The Branstad-Reynolds decision to close the facilities at Clarinda and Mount Pleasant led to a dramatic decrease in the number of inpatient beds available to Iowans in crisis situations. And it placed significant new burdens on other healthcare facilities that are not equipped to provide the services those people desperately need. On our mental health tours, Rita and I have repeatedly heard from patients and local providers who cannot access the local mental health services that they need. Patients are refused care due to lack of available beds, available doctors, and have to drive hours to get treatment. The privatization of Medicaid is also negatively affecting mental health care. I met Cole in Iowa City. He's a young man struggling with mental health issues. He and his mom, Tammy, told me how Medicaid privatization has caused delays and denial of services that he needs. Mental health providers are struggling to keep their doors open due to delayed or denied payments from the private out-of-state managed care organizations. We can't ignore this problem any longer. Mental health issues impact people of all ages and all communities. Governor Reynolds will say she passed a great bipartisan bill on mental health, but to me, it's just a political Band-Aid. The bill was a step we can all agree on, but it provided no funding to local communities to deliver the care. Instead, it just burdened them with more unfunded mandates. Once again, the government of Iowa will be studying what needs to be done in the mental health field, when in reality, we already know. We must address the crisis by putting real funding behind this issue because this suffering is not acceptable. We also need to review the state's regional approach to mental health. When listening to Iowans, it's clear some regions work better than others. Some have too few resources. Others have a little more. But the overall system lacks accountability and consistency. An Iowa poll conducted in January this year found 73% of Iowa adults believe the state's mental health system is in crisis. Less than 2 months later, in March of 18, Governor Reynolds cut $4.3 million from Iowa's Department of Human Services. That's the department that manages our state's mental health system. These cuts compounded the problem as access to mental health care for thousands, particularly those living in rural communities, was already threatened. Governor Reynolds recently signed into law the new Farm Bureau health plan for Iowans. But critical mental health coverage is not included in that bill, and those plans do not cover pre-existing conditions, including mental health issues. Instead, we should be working with insurance providers to make sure that we actually have parity for mental and physical illnesses in our state. As governor, I will support the development of at least 50 to 75 high-intensity mental health beds across the state so we can truly provide the continuum of care that to help the people who best need all levels of service. As governor, I will also support expanding community-based care by investing in more training and funding for psychologists, social workers, and nurses. That will help Iowans address mental health issues before they reach a crisis point and before they need to access a state-level institution. Lack of community-based support and investment in prevention forces those in need of treatment into extremely costly emergency room visits or jails. It costs more than $30,000 annually to incarcerate a person in an Iowa prison. An average emergency room visit costs upwards of $1,000. Growing evidence is clear that by investing in community-based mental health facilities and diversion programs in our county jails, overall cost to the community can be substantially lowered. During my mental health tour to 8 of our county jails, I saw firsthand the role that our public safety officers and correction facilities are forced to play in caring for our mental health patients. Roughly half of the prison population in Iowa have mental health issues. 40% of the male inmates, 60% of the female inmates. By properly addressing mental illness through diversion programs and strong community-based treatment, we can save our jails hundreds of thousands of dollars by reducing recidivism. Last December, our campaign proposed a mental health plan the week before your first forum. That health plan suggests that we need to invest in local community-based providers, including diversion and substance abuse programs. We need to increase the number of long-term, high-intensity beds across our state, and we need to create Iowa's first youth mental health program. The fact that I was going back to the drawing board for another study on children's mental health service delivery system means that we are ignoring what we've already studied and we already know. Increasing the availability of these services, particularly within our schools, increasing trained professionals, and providing appropriate funding will do much to improve care for youth. Mental health problems like depression and anxiety affect 1 in 5 children in our state today. There needs to be a public health response to children's mental illness before it reaches epidemic proportions. We need more counselors and mental health professionals in our schools. But unfortunately, our school counselors are being let go due to education budget cuts. And there are drastically low levels of children's mental health psychiatrists and nurses in our state. We need to encourage programs and partnerships with school districts for early identification, prevention, and treatment for children. We need to include pediatricians and family physicians in the mental health screening process to help early identification and treatment. But Iowa does have several programs that are working. They need more support. I met a gentleman in Davenport with mental health needs. He'd been to jail multiple times and always struggled with his illness. But this time he was lucky enough to end up in a mental health court, which focuses on rehabilitation instead of incarceration. and the mental health court helped him get back on his feet and eventually back into a full-time job. Unfortunately, this program is struggling due to lack of state funding. We also have the SafeNet RX program, which provides medications and medical supplies to those who can't afford it. It helps those with mental health needs keep on their medication and helps them with reducing recidivism. Many of us here today know that we don't need another study. What we need is leadership and real funding to help solve the problems. I look forward to answering your questions today. It's time to restore opportunities across our state. It's time to invest in people again in our state. And it's time to work across the aisle for the benefit of all Iowans. Thank you very much.
Okay, thank you.